Hi, everyone. This is Aurelie Najm from Glasgow. I'm reporting live from Milan. Day one of the conference, great turnout, great weather. There was quite a lot of interesting stuff, really, but there was one abstract I wanted to talk to you about. It's oral presentation 0066. It was presented at the psoriatic arthritis session by Aurelie. Really interesting stuff. So see, when we talk about PsA and RA and comorbidities, we say, oh, these people have been had, inflammation in a chronic way for a very long time. This has been driving higher cardiovascular risk and higher comorbidities. However, there is this concept as well, of metabolic burden in PsA. And then there is this hypothesis that this burden is present from the very beginning of the disease. And so this is what they wanted to assess really and to look at by taking two different cohorts of patients with a very early diagnosis of PsA and RA, actually before even they were treated with any DMARDs, and that had symptoms for less than 2 years. So they took a bit over 60 patients with PsA, a bit over 50 patients with RA. They age and gender matched them also together, but also with healthy controls, with roughly 50 healthy controls. And they looked at different comorbidities. And this is quite interesting, right? So overall, to start with, the percentage of comorbidities at baseline was above 60% in all the groups, even in the healthy control. So it was a quite high comorbidities population. But then what they did is they also look at specific comorbidities in the two different groups, RA versus PsA, and they showed that a lot of them were higher than healthy controls, diabetes, obesity, hypertension, dyslipidemia, but they were not different between RA and PsA. However, PsA patients at baseline had higher gout and higher percentages of depression. Now, considering the fact that most of the cardiovascular risk were similar in both populations, there is a very interesting finding, is that cardiovascular events were, however, higher in the PsA subgroup, and also PsA patients tended to have a higher number of comorbidities at baseline as opposed to RA and healthy controls. And so I think this is quite interesting because, first of all, this shows that these comorbidities are present very early in the disease and not after years of, chronic inflammation. And also they're associated with a high number of cardiovascular events at baseline. And, I think this is very important because this means that we need to focus on that straight from the beginning, straight from diagnosis, even before we think of giving DMARDs for the disease. This should be taken into account. So I think this, for me at least, was very important. I think I will use this data in my practice, and I hope this was helpful for you as well. And I invite you to connect on rumnod.com for some more content and follow me on Twitter at Aurelie Najm. Bye, everyone.